Immunity is of two types, active and passive immunity. Active immunity is again of two types, natural and artificial immunity, and passive immunity is of two types, natural and artificial immunity. Coming to innate immunity, it does not depend on prior contact with foreign antigen. This statement explains that it does not depend on memory, and it can be non-specific or specific. Types of immunity: species immunity, individual immunity, and racial immunity. Species immunity: resistance to a pathogen is shown by all members of a particular species. Example: Bacillus anthracis infects only humans but not chicken. I can give a better example. I think if I, I'm sorry, I am a human. If I am had resistance towards one particular pathogen, and we all have resistance towards one particular to that particular pathogen. For example, if I am immune to cholera, we will all are immune to cholera. But that's not right. For example, I am telling it. And racial immunity: resistance to a pathogen shown by a particular race of species. Example: races with sickle cell anemia are immune to Plasmodium falciparum infection. It causes malaria, and races with sickle cell anemia are seen in Africa and they are immune to Plasmodium falciparum infection. Individual immunity: resistance to infection varies with different individuals of same races and race and species. This is known as individual immunity. For example, homozygous twins exhibit similar degrees of susceptibility or resistance to tuberculosis. In contrast, such correlation is not seen in heterozygous twins. Homozygous twins are twins that came from same zygote which is divided into two, and heterozygous twins are the twins that came from different zygote which develop into two different infants, whereas homozygous twins are the twins that are developed from same zygote. Examples for heterozygous twins are if the twins are male and female, they are heterozygous twins. Heterozygous twins can be or cannot be of same sex, but homozygous twins should always be of same sex. And factors influencing innate immunity: age, hormones, and nutrition. Age: the extremes of life that are infantile and old age people have less immunity, maybe because of thymus gland which is developing in infants, and the growth of and the thymus gland gets deteriorated when we get older. That's seen in old age people. And nutrition: immunity is less in malnutrition children or adults. Mechanisms of innate immunity: epithelial cells, antibacterial substances, cellular factors, inflammation, fever, and CRP are seen in innate immunity. Epithelial cells: skin, respiratory tract, gastrointestinal tract, conjunctiva, genitourinary tract. Skin acts as a mechanical barrier to our body and does not allow the entry of pathogen into the body. Respiratory tract: we all have nostrils. Nostrils have hair follicles that will stop harmful pathogens in the nose and does not allow the entry of pathogens. Even if the pathogen entry into our body, the phagosomes inside the body will engulf the bacteria and later it can be coughed out. Gastrointestinal tract. We all know we secrete digestive enzymes, and those digestive enzymes will lyse the bacteria and conjunctiva. Conjunctiva, okay, eyes. Let's talk about eyes. Eyes have tears, and tears will have a lysozyme enzyme which will lyse the bacteria. And genitourinary tract. In let's talk about females first. Females have vagina, and vagina will secrete certain uh, chemicals which are hostile for pathogens. It have certain pH which does not allow certain pathogens to grow, and it can be cidal too. Antibacterial substances complement interferon, beta lysine, and basic polypeptides are known as antibacterial substances. Complement interferon, beta lysine are non specific. And cellular factors, phagocyte cells, macrophage and microphage are known as phagocyte cells. Chemotaxis, attachment, ingestion, intracellular killing is the steps that are followed by phagocyte cells for the killing of pathogens. And in short way, I can explain what is phagocytosis. Let's say if this is our WBC or macrophage, and this is our pathogen, and this macrophage will engulf the bacteria and break the bacteria into smaller pieces, and later the phagosome can be coughed out, can be eliminated from the body. Inflammation is seen, and fever. Increase in body temperature is known as fever. Certain bacteria or virus or any pathogen cannot tolerate high temperatures. That's why our immune system will increase our body temperature. Acute phase reactant proteins. These are some proteins which are elevated during inflammation or during immune responses. So, how can we detect CRP? CRP can be detected by using a test called latex agglutination test. What happens if there is increased levels of CRP? It indicates that there is a risk of cardiovascular disease or any inflammation present in body. Let's summary. Summary of the components of innate immunity. We seen barrier mechanisms. Mechanisms of skin, respiratory tract, intestinal tract, genitourinary tract are known as barrier mechanisms. Non-specific antibacterial substances such as complement, lysosome, interferons are also part of innate immunity. Phagocytic cells such as neutrophils, macrophages are known as phagocytic cells. NK cells are natural killer cells, are non-specific innate immune cells. Fever and inflammation are seen, complement pathways, alternative pathway is seen, and acute phase reactant proteins are seen. Acquired or adaptive immunity. Acquired or adaptive immunity is of two types: active immunity and passive immunity. Active immunity is of two types: natural and artificial. Natural active immunity is seen when there is clinical or subclinical infection, and active artificial immunity is induced by vaccination. What happens when we inject vaccine will lead to active immune response, stimulating both humoral and cell mediated immunity. Now, what is humoral immunity? It is antibody mediated immunity. It depends on synthesis of antibodies by plasma cells. Now, where this plasma cell is synthesized? We know that we have stem cells and The blood stem cell is responsible for the synthesis of lymphocyte stem cell, and lymphoid stem cell is responsible for lymphoblast synthesis, and lymphoblast is responsible for synthesis of B lymphocyte, T lymphocyte, natural killer cells, and B lymphocyte cell is responsible for the synthesis of plasma cell, and this plasma cell is responsible for the synthesis of our good antibodies, and these antibodies are IgG, IgM, IgE, but there are total of 5 antibodies discovered. They can be remembered as GameD, IgG, IgM, IgA, IgD, IgE. Cell mediated immunity. It depends on T lymphocytes. T lymphocytes are developed against certain antigens. Antibody synthesis also occurs in response to these antigens. Now, here we know, we already saw that B lymphocytes is responsible for the synthesis of our antibodies, and this is known as humoral immunity. And here we saw that T lymphocytes are responsible for cell mediated immunity. We already saw that in innate immunity that natural killer cells are non-specific cells that are responsible for innate immune response. And natural active immunity. Persons recovering from smallpox infection develop natural active immunity. Artificial active immunity is done through vaccination. Vaccines. Let's talk about vaccines. We know that there are 3 types of vaccines: live vaccines, killed vaccines, and bacterial products. Live vaccines, BCG vaccine is given at the time of birth to prevent tuberculosis, and TY21A vaccine is for typhoid fever, and Sabin vaccine is for poliomyelitis, which is caused by poliovirus. MMR vaccine is for measles, mumps, rubella vaccine for rubella virus, and the other 2. 17D virus is given for yellow fever. These are examples of live vaccines where live cells are given. Killed vaccines examples include TAB for enteric fever, which is caused by salmonella, and killed cholera vaccine for cholera, Vibrio cholera, and Salk vaccine for poliomyelitis, for poliovirus, and neural and non-neural vaccines for rabies. Hepatitis B vaccine is given for HBV, and bacterial products are given in case of tetanus, tetany, which is caused by tetanus. Sorry. For bacterial products is given for tetanus, which is caused by Clostridium tetani, where tetanus toxoid is given, and diphtheria toxoid is given for diphtheria. Passive immunity is induced by when an individual passive immunity is induced in an individual by preformed antibodies. Passive natural immunity, it is transferred from mother to fetus or infant. So from mother to fetus transplacentally when the baby is present in the womb, and from mother to infant through colostrum. Colostrum is the milk that is given when lactating from lactating woman to its infant. Passive artificial immunity, parenteral administration of antibodies. The characters include: there is no latent period, passive immunity is short lasting but is useful when immunity is required immediately, and there is no immunological memory. Question: How antibodies are formed. Here we told that parenteral administration of antibodies is done. How we prepare these antibodies? By the preparation of convalescent sera. Convalescent sera is a hyperimmune sera which is prepared by injecting tetanus toxide. It's an example. By injecting tetanus toxide to horse, and horse will produce antibodies, and those antibodies are injected to an human. And it can also be prepared from those antibodies can also be taken from the patients who are recovering from infectious diseases. And that is why we will tell the patients or the mothers to breastfeed their child, and through breastfeeding the milk is known as colostrum. Through colostrum, the antibodies from the mother is transferred to infant. Uses of passive immunity. In erythroblastosis fetalis, the antibodies are injected to mother, and for treatment of serious infections such as diphtheria, gas, gangrene, tetanus, passive immunity the passive immunity is useful by giving antibodies to the patients. We can save the patient, and it is also useful in post exposure prophylaxis of rabies. And post exposure prophylaxis of rabies, that means if a child or any person is not in hospital, if the person did not have vaccine for rabies, after his or her infection with rabies, we can give antibodies to that person to save that person. Summary. The difference between active immunity and passive immunity is active immunity is long lasting and passive immunity is immediate, and active immunity takes time and passive immunity does not take that much time, and have no memory, it have memory. This is all about active and passive immunity, which are seen in acquired or adaptive immunity, and innate immunity, which is possessed from birth. Thank you.